Hi, good morning. My name is Araceli Trevino, registered dietitian with the El Paso Center for Diabetes. I teach the diabetes self-management classes to type 2 diabetes.
Hello, my name is Cynthia Costa. I'm the Chief Nursing Officer here at Centro San Vicente.
Hi, Cindy. How are you?
Hi, I'm good, thank you. And yourself?
Good, thank you. So I understand that we have a new vaccine out. Can you elaborate a little bit more on your personal experience on COVID?
Absolutely. Like many people here in El Paso, I myself also knew of a lot of people who passed away from COVID. My relatives, our friends, our employees' relatives. It's been a hard situation.
Yeah, I'm
to
sure
go
it's
through.
been hard, and now we're going into the fourth year of the pandemic.
Yes, ma'am. Many El Pasoans here were absolutely ready for that first vaccine to arrive, which was awesome.
Right.
It did help us with keeping our community protected from COVID for this past couple of years. But again, unfortunately, our immunity is waning now, and it is our top priority to keep up with the most recent COVID vaccines.
What is this new COVID booster and why is it better?
The new vaccine that we have right now is the bivalent booster. Now, we have to know that these vaccines have been shown to keep the patients out of the hospital or for them being critically ill. Now, for that result, those people who get their vaccines are less likely to die.
Wow, that's a great news. And so, what do we need to do to make sure we're updated with our most current vaccine?
For teens and adults, if they do receive their most recent dose before September of 2022, then you are eligible for the bivalent booster vaccine.
Wow, is there a waiting period?
There's no waiting period. For example, here at Centro San Vicente, we have a drive-through. We are open to the community. You're a patient, not a patient. We're still seeing everyone. We go out there to the community as well to capture them there for those who don't have transportation means as well.
Wow, that is great. And can you elaborate a little bit more on the cost?
Absolutely. There is no cost right now. I know that their emergency is going to end on May 11th. So for now, we're not sure as to when, but I can definitely tell you that it's free right now for everyone.
Wow, that is great news.
We also have the vaccine for children, and if they received it before October of 2022, they are eligible for the bivalent as well. If you are unsure, please just go ahead and call your doctor, talk to them, or your local pharmacist, and they'll go ahead and guide you.
And so just one more question. I do, as a dietitian, I get to see a lot of patients that are immunocompromised. So type 2 diabetes, hypertension, and so their immunity is not as strong. So what recommendation do you have, or what should I tell my patients as far as vaccine and being that they're so immunocompromised?
For those immunocompromised patients, it's very, very important that they do receive all of their sets of vaccines for COVID. It's very important. When COVID first started, the vaccines first came out, the immunocompromised patients were the first ones that received the vaccine. Okay. So yes, absolutely, they continue to be first priority as well.
Okay, and so as far as the patients, is there an age group that we should really be focusing on or targeting the most?
We actually see at every age demographic right now, but we are actually focusing on our 50-year-olds and over age demographic, and that's only because they have more chronic conditions, and they're more likely to die if they do proceed with COVID.
So as a dietitian, I get to see a lot of patients that are immunocompromised. I get to see type 2 diabetes, hypertension. So these patients, what recommendations do you have for me that I should tell them, especially because they're immunocompromised?
Okay. So for immunocompromised patients, ever since the beginning when the first vaccines arrived, they were the very first patients who were eligible to receive the vaccine. And it continues the same. We highly recommend for those immunocompromised, those who have chronic situations, they need to get their vaccine. So, you're doing amazing and letting them know.
So what is the process when a patient tests positive for COVID?
Okay. Here at the clinic, what we do the point of care testing. We incorporate the COVID testing as well. Okay. And if a patient tests positive for COVID, they are transferred over to the provider. The provider sees them, and then they do prescribe Paxlovid medication. Paxlovid medication is an antiviral medication which actually stops that virus from multiplying inside your body. And then for that reason, you are going to get fewer symptoms within a shorter amount of time. Again, you do have to take it within the first few days so that it can be more effective.
Oh, okay,
This
great.
medication, it is widely available. So all you have to do is just call your doctor and get a prescription.
Okay, great, great. That's good to know. Thank you for watching, and make sure you update your current protection.